Any time is good, but September is Recovery Month. And to help with the journey, we're learning about the resources and support available. Joining me now from the Sacramento County Department of Health Services, Lori Miller, Monica Langlais. It's good to have you both here. Monica, let me ask you this. If someone's watching and they don't know that they have when do you know you have a problem? Most people deny it first, right? I don't have a drinking problem, and I only party a little bit. When is it a problem?
Well, usually when you have consequences.
Okay.
And when it's no longer working to change the way you feel, and the way you feel is worse than the way you felt before. You start losing things like your children, your house.
That's sort of late on. That's sort of late on in the thing.
Sometimes.
Do we want to catch this before that happens?
It would be nice.
Yeah.
Yes.
Absolutely. Lori, let me ask you this. The screening and coordination, this is what you folks do. Tell me more about that.
Yeah, Sacramento County Behavioral Health Services has a new call center, and it's called Behavioral Health Services Screening and Coordination. So somebody who is struggling with a substance use disorder can call 875-1055 and get screened that day for services and get a referral to the appropriate level of care.
Are you busy?
We are busy.
So people know about it?
People know about it.
Okay.
It's a new process. It's a new screening center. We're really trying to decrease barriers of people entering our service system and getting the care they need for substance use or mental health.
Okay, that's a good point to set you up with this one. When people enter and they check in for the first time or it's their first experience, what is that like? What do you try to do for them?
We try to make them as comfortable as possible. We try to meet them where they're at, be it in their home or wherever they're residing at that time. We try to make sure they're connected to the correct services, and we're extremely supportive. Most of us in the field have our own histories, so we can relate on a really special level and just let them know that it's a judgment-free zone, that it's not a moral issue, that this happens to people that you wouldn't believe, and it happens to lots of people.
Oh, sure. I think that's good for everybody to know, especially when they do check in, that this is a large group.
Yes.
You know, and a lot of people that are not getting help should. Are the families involved of the people who are trying to recover?
Sometimes they are, sometimes they're not. Sometimes it's generational, and the families have their struggles too. And that person gets to be the example of what recovery looks like for the people before them. A lot of people come in with really supportive families, or they've done damage to that. So they get to walk this journey, and as they get healthier, those bonds tend to re-solidify, and they get healthier.
Lori, speak to someone right now who might be on the fence, and they call you. What will they experience right away?
They'll experience support. You know, we're here to provide help and support to people, and it's just one phone call away. And the beautiful thing about September is it's National Recovery Month. And so we want to celebrate those people that have struggled, that are struggling. We want to encourage people to get the services they need.
Sure.
And to also lift up and acknowledge the wonderful accomplishments people have actually made in this community by getting clean and sober.
That's amazing, and it's free.
And it's free.
Yeah.
Okay, that works. Ladies, Lori, and thank you both very much, Monica Langlais as well. Thank you both.
Thank you.
Thank you.